The history of depression. Depression has existed for thousands of years, even as early as ancient Mesopotamia in the second millennium before the century. To ancient people, a depressed person was not simply sad or mentally unwell. People believed that depression was caused by demons.
Enemy of the faith. Give me your name, demon!
So, instead of receiving treatments from doctors, they were taken to priests, where prayers, rituals, and exorcisms became the medicine used to fight the invisible evil inside them. Today, antidepressants are widely used to treat depression, but one myth still exists. So, do antidepressants really turn people into zombies?
Hey, Sofea! Anyway, what if I told you that the first antidepressants actually come from rocket fuel? In the 1950s, scientists were testing leftover World War II chemical fuels to treat tuberculosis patients. Then came the unexpected discovery, one drug called aproniazid given to the tuberculosis patient.
Nice.
But doctor noticed something unusual. Their mood seemed to be improved.
Oh my god! Wow!
Eventually, this led to the first discovery of the first antidepressants, as known as the monoamine oxidase inhibitors or MAOIs. And just when the scientists thought that MAOIs were the first big breakthrough, another accidental discovery happened. Tricyclic antidepressants were introduced. With great powers always come with great responsibilities. Therapeutic effects always come together with side effects. For example, dry mouth, neck, high blood pressure, and constipation. At high doses, tricyclic antidepressants can be life-threatening, and it may even lead to death. Although antidepressants often cause strong sedations, fatigue, and cognitive slowing, some patients may appear emotionally flat, physically slow, and even less responsive.
Hello? Hey!
Stop it. Get some help.
Hence, the origins of zombie myth. People say
2 hours later.
this created a stigma that antidepressants may change people into zombies. Then, in 1980s, newer antidepressants called selective serotonin reuptake inhibitor or SSRI were developed. They were designed to be more targeted and causing fewer side effects. But SSRI may still cause emotional blunting in some patients. Wait, cameraman, look at that! We need to help her!
The question is, can newer antidepressants overcome these limitations? One example is vortioxetine. It is a newly antidepressant used to treat major depressive disorder in adults. It belongs to a class called serotonin modulator and stimulator, SMS. Unlike traditional SSRIs, vortioxetine doesn't only increase serotonin levels, it also acts directly on several serotonin receptors.
First, vortioxetine inhibits serotonin reuptake. This helps to increase serotonin activity in the central nervous system. But vortioxetine is also known as a multimodal antidepressant because it acts directly as a modulator of serotonin receptors. It also acts as an agonist at the 5-HT1A receptors, partial agonist at 5-HT1B, and antagonist at 5-HT3, 7, and 1D receptors. So, this multimodal mechanism may contribute in antidepressant, anxiolytic, and cognitive benefits.
Like all other medications, vortioxetine can also cause some side effects, and the most common is nausea. Are you okay, sir? Oh, I'm Auni, the pharmacist at Q Pharma.
Miss, I started taking vortioxetine lately, but I feel like I want to puke. Is that normal?
Oh, don't you worry, that's the most common side effects for vortioxetine.
Oh, I see. So can I stop taking it because I feel very sick lately?
No. Because instead, you may experience withdrawal symptoms like dizziness, agitation, irritability, and headache. Vortioxetine should also not be used together with MAOI. Extra caution is needed in patients with liver disease, bipolar disorder, seizure, pregnancy, lactation, and CYP2D6 metabolized drugs.
Welcome to our international quiz competition! So, today we have our competitors, which is Team SMS and Team SSRI. So, our first question is, between vortioxetine and SSRI, which one is better? Okay, go ahead.
So, SMA has a multimodal mechanism. Compared to them, they only block serotonin reuptake.
We also have less emotional blunting compared to them.
And SMS also have direct cognitive benefits.
And most importantly, we have lower reported rates of sexual dysfunction compared to them.
Congratulations to Team SMS!
Loser!
What did we 5 points? Well done! Okay, so actually, studies also suggest that vortioxetine have a lower risk of emotional blunting compared to some SSRIs.
So, back to the question, do antidepressants really turn people into zombies? No, not exactly. The myth originated from older antidepressants that cause heavy sedation and emotional flattening. Oh, enough. But modern antidepressants like vortioxetine can reduce some of these side effects. So, before we end this video, depression treatment should always be individualized and monitored by healthcare professionals because treating depression is not just about removing the emotions, it's about helping people to regain their lives.
And remember, depression is not a weakness, and seeking treatment is not something to be afraid of.
If you or someone you know is struggling with depression, do not be afraid to seek help. Talk to healthcare professionals, pharmacists, doctors, counselors, or someone you trust. And before believing in myths about antidepressants, learn the facts.
Break the stigma!
Spread awareness!
Support mental health.